I've always been really interested in people and why do people do the things they do and why do I do the things I do and how can I change those things. So I've always been sort of introspective that way in thinking a lot about people in their environments.
Hello and welcome to another episode of Buzz in Behavioral Medicine. In this electrifying episode, we're talking with Dr. Abby King, a professor at Stanford. In this episode, Dr. King shares her many pearls of wisdom and how she freed herself from the shoulds and the musts. Dr. King has been on the cusp of innovation throughout her career, and it's fascinating to hear her talk about her citizen science research, as well as human-centered AI and how this technology can expand our opportunities in behavioral medicine. Hold on to your seats. This is an insightful episode packed with life lessons and cutting-edge research. Well, it's great to talk with you today, Dr. King. I'm so glad you're able to join us. This is wonderful to be able to talk with you. I know you mentioned call you Abby, and then I'll call you Abby. But it's wonderful to speak with you today. Thanks for joining us today.
I'm really delighted to do this. I'm so excited that SBM has so many programs like this that are ongoing, and it's always fun for us to be able to talk about ourselves a little bit. So thanks for inviting me.
I saw from some of the materials that you sent us and sent me that that you are a twin. You have an identical twin, is that right, or fraternal?
That's right. And actually, we're a rare subspecies of identical twin in that we're mirror twins, which happens when the embryo splits in a certain way. And we have opposite sort of dispositional characteristics. So I'm a lefty, Sandy's a righty. Her hair whirls one way, mine whirls. There's all of these differences. And actually, when we were growing up, we did a twin study together at the University of Buffalo where we were living. And they told us about all of these mirror sort of differences. So that was sort of fun to learn about.
That's fascinating. Yes. I'll put a little plug. We have the Mid-Atlantic Twin Registry here at Virginia Commonwealth University. And it's one of the larger twin registries in the United States. So,
that's very impressive.
You know, growing up a twin, there probably were some challenges and some, some benefits to that. And how did growing up being a twin, shape some of the ways that you developed?
Yeah, it's an interesting question. There were a lot of advantages. For instance, you have a built-in tennis partner and running partner and, someone to share a lot of memories with, which is what we do these days. Things that I can't remember, Sandy remembers and vice versa. But there are a lot of challenges, especially being an identical twin. People are always comparing you. And so I think that I started at an early age asking some of these deeper questions about who am I? Because a lot of being an identical twin is to try to really differentiate yourself from your twin. So I think that was one of the reasons why I went into psychology, was because I was asking, how am I different? Who am I? Sorts of questions.
Yeah, and you must have also kind of been interested in that sort of genetic similarities, plus how does the environment impact the way you develop? And
Yeah, exactly. And it was interesting. I remember seeing some early twin studies where they always defaulted about, the environments are exactly the same for identical twins, and it's all, it's the genetic and other things. They treated the environment as if it was a constant for identical twins versus fraternal twins. And actually, that's not true. The environments for the twin and how socially people relate to you are actually quite different. Even though you're maybe in the same setting, you take different roles. You're expected to act in different ways. It's very interesting. It's a lot more complicated than I think your typical twin scientist might think. I always wanted to get into some of that research, but I haven't had the opportunity. but I've always been really interested in people. And why do people do the things they do? And why do I do the things I do? And how can I change those things? So I've always been sort of introspective that way in thinking a lot about people in their environments and what drives us to make the choices we make. So Binghamton was wonderful because has a very strong social sciences areas, and especially psychology. When I was going through Binghamton, their psych department was great. They had a lot of young, very talented faculty doing really amazing research. And the department, for instance, they were very strong in child psychology. So in the basement, there was a living laboratory, a preschool that was a living laboratory. So we were able to do developmental research around gender identity and things that I'm still very interested in today. And then up on the third floor of the psych department was the clinic for autistic and schizophrenic children. So you were able to see the spectrum of differences among these young children. It was wonderful, and to really learn very rigorous research. So I really had a great experience at Binghamton, and it really launched me, I think, into psychology.
So kind of got the psychology bug and became very interested in those differences. And so you went on to graduate school. How did you make that decision to go to graduate school? Was there someone in your career path that was telling you, hey, maybe you should do this, or were they telling you to go into a different field altogether, and you just ignored them, or how did you decide that?
Well, it's interesting. I come from a family of achievers, and so there wasn't ever any question about all of us. I have 3 sisters, so there's 4 girls in my family, and my father set the tone in the sense that we were expected to really achieve. And so I actually never really questioned that too much. But I did have, I would say, a mind changing sort of experience when I went from Binghamton and I was applying to clinical psych programs. I had a faculty member who was very supportive, and she wanted me to apply to all the top psychology programs in the Northeast because that's where she went to school. And I applied, and I was on some waiting lists, but I did not get in. So it was my first failure experience, and nobody in my family fails. That wasn't something. But I have to say, Bernard, it was life-changing
Yeah.
for me because it freed me from all of the shoulds and musts and things. And that's one of the life lessons that I want to pass on to anybody listening to this podcast, is that you need to let go of other people's shoulds and musts, because that's all coming from other people and not from you. And so for me, I felt free. I realized, oh my goodness, I don't have to get a PhD. I could get a master's degree and do counseling, or it just opened my world. And so I took a year off. I did a lot of research with different populations around Binghamton. My faculty there were incredibly supportive of me doing that. I learned a lot. And then I was really ready to I made the decision myself at that point that I want to go for the PhD. And I got into 10 programs the next year. Well, because I was much smarter at being able to look at the programs that I would be able to get into and that would be meaningful for me to go to. And so Virginia Tech was one of those, and it really attracted me because it had young, scientifically rigorous faculty. They were bringing in new faculty doing cutting edge things. And so I'm really glad I made that decision because they were doing behavioral health research in their clinical psych program back in the 1980s before anybody, virtually anybody else was doing that. Most of the programs, especially in the Northeast, were very mental health, clinically, traditionally oriented. And Virginia Tech was mixing it up a bit in terms of both behavioral health, which was great. That's where I got turned on to studying things like physical activity. And also, there were a couple of cutting edge faculty, Dick Winnett, who is an SBM member, and Scott Geller, who was someone else. They were doing environmental sustainability change, interventional research before I think almost anybody else in the country. This was back in the late 70s, 80s, that they were doing it.
What does that mean, environmental change?
Well, teaching people how to lower their electricity bills by being more thoughtful about using electricity, using water, all of the things that now with climate change that we're all in trying to figure out. They were doing that back in the 70s and the 80s. And so I got exposed to these clinical psychologists who were doing all kinds of really interesting, sort of out of the box sort of things. And again, I think that was a unique experience in terms of Virginia Tech having that kind of mix of faculty.
You mentioned stress and physical activity, and that was some of the work that you got involved with early on. What was it about that sort of?
Why did I choose that?
Yeah.
Well, Bernard, what I have found with a lot of psychologists, at least growing up as a psychologist, is that psychologists often study what we're not very good at. So Lee Fredrickson and some of the early smoking cessation people were into that because they had been smokers and they were trying to quit and they were trying to figure out how best people could do that. So for me, I've always struggled a bit with making physical activity a regular part of my routine. And so I do it, but I rarely enjoy it. And so I am like the 90% of the U.S. the American population that knows that we all know it's good for us. We all know that we should do it, but it's really hard for many of us to fit it into our day. And so there were very few people back then doing physical activity research. Len Epstein was one of my heroes, John Martin. They were doing it back then, but they tended to do it more in groups. And I was trying various things theoretically to look at different aspects of physical activity, some more cognitive things as well. So relapse prevention, for instance, is what I did my master's on.
So kind of taking some of the work from the tobacco addictions area and kind of applying some of that models to how do you maintain.
Exactly right. Yeah.
Yeah, so that's wonderful. And you went on to University of Mississippi. You did a clinical internship there. It's a great clinical training program. Actually, I think Len Epstein went there as well. You mentioned him.
Yeah.
So what was it about that program?
When I was going through grad school, I got sort of burned out on academia. And some of it was the politics of academia and things like that. And I remember thinking to myself that the last thing I wanted to do was to go into academia at that point. I wanted to counsel or do some clinical work in the real world. But then when we had to apply for our clinical internships, I have to say I found myself repeatedly being drawn to the kinds of clinical internships that really had a strong research bent, one being the Jackson, Mississippi Consortium, another being Brown University. So I found myself applying to those. Lee Fredrickson had been down at Jackson, so a lot of my mentors had come through the Jackson internship. And so I went down there. Stuart Agris, who many of us consider to be the father of behavioral medicine, started. So here I was thinking to myself, no, I don't want academia yet. I loved research. So yeah, I applied and I went to Mississippi and I learned a lot about various ways of doing research in clinical settings. It's really a great place where behavioral medicine was really thriving down there.
Now, I want to ask you, how did you kind of solve that cognitive dissonance between, loving research, but then not wanting to do academia? Or are you still trying to work on that?
No, well, it's, the politics of academia can be really intense. And one way I've solved that is to go interdisciplinary, which frees you from the intradepartmental strife. I mean, it's so interesting to see how science has developed over the decades since I've been in science, where it's oftentimes the departments were very focused inward. And we still have that a little bit here at Stanford in the Humanities and Sciences School. But increasingly, this issue of being interdisciplinary, the importance of interdisciplinary research has really flourished. And it flourished early at Stanford. When I was there, still am, but early on, it started to flourish, and that sort of frees you from some, I think, of this within the box thinking that you get within departments. So what's interesting is back then, and still in many psych departments, I think, they choose people to be different. Right? They're looking for a child person, or they're looking for someone to do PTSD or whatever it is. And so they have a group of people who are set up not to work with one another.
Right.
Because each of them are focused on their area. And that, I think, at least in other departments, is really breaking down now, because people realize that interdisciplinary research really holds the key to answering and advancing a lot of the complex problems that we are facing right now. No single department can do it. You need multiple perspectives. So I think what I have found is interdisciplinary research helps to free you from some of that more stilted within department, within discipline thinking.
That's a very good point. Just having that ability to work with people who see things from a different lens, and they're looking at the same problem, but, coming up with new methods, applying those new methods to different solutions. So that makes it more exciting, right? It makes it, you can do the research and then also be excited about academia in that way.
Yeah, exactly right. So I found myself going towards what I loved about academia and we all have to put up with the administrative parts of academia, but that's why I loved behavioral medicine. Right. So, those of us who you're interviewing, a lot of us were at the dawn of the Society of Behavioral Medicine. I went in 1980 one of my first conferences when Stuart Agris was president. And what I love about SBM is this interdisciplinary focus, understanding the broader picture of what we're trying to do in the world.
You've been at Stanford for many years, your whole career, right? So you ended up staying there. There must have been some challenges along the way, but it's really been your academic home. How was it kind of? And I know it's probably hasn't. Maybe it's gotten better over the years, but it maybe hasn't been as friendly to PhDs as MDs.
Well, it's true. In the medical school, Stanford divested of all of its allied health programs right before I got there. They were in the process of doing that. So they had a nursing program. They got rid of that. They got rid of their exercise physiology program because they decided it's a small university. and they decided that they wanted to focus on the things that they could do the best. And they knew that they were spread too thin. So it's still a lot of, the med school where we were is very heavily medicine, but over the years, it has really changed over the decades. But when I got there, and this is another life lesson, Bernard, that I want to share, is that nothing succeeds like perseverance and persistence, because my Stanford career is about a lot of hearing the word no and then finding ways to still succeed. So after the postdoc, there was no place to go because they call them faculty billets. They were like gold. They were so difficult to get, and they certainly weren't going to give it to PhDs. And so several of us, when I went to my postdoc director and said, gee, we're doing such interesting research, I want to continue it for a few years. And he said, no, there's no route for that. So I wasn't the only one in this position. Several of my peer postdocs decided that we really wanted to stay, and so we found a position. It was a research scientist position that nobody had really been using in our center. And it's fully funded by you have to fund it under a faculty member. So you can't write grants, at least you can't run the grants that you write. A faculty member is overseeing everything. But it allowed several of us to stay on working with faculty to be able to continue to grow our research. And then in 1989, I was able to get a K award.
Yeah.
And that required a lot of exception. They had to make an exception for me to get the K award.
Mm-hmm.
And bless the person who said yes. Several people said, no, we don't do that. But someone said, yes, this is a developmental training thing and we should support it. So the K award happened in 1989. And I was working with Bar Taylor, who we just lost, who was incredible. Bar was the one who introduced me to technology. Bar was doing technology in the 1980s before almost anybody in terms of portable computers and things like that. He lent me portable computers so we could do some auditing and assessing of people's mood and other things out in the field during their day. And that was pre-PDA.
Right.
So
pre-PDA and pre-EMA.
Yeah, and most of your listeners probably don't even know what PDAs are, personal digital assistants.
Yeah, that's right.
Are. So then a faculty position came open at SPRC, and it had become a center. So when I got there was no Stanford Prevention Research Center. It was just a program. Then it morphed into a center. And they put out the call, and they really wanted MDs. All the faculty were MDs. And they spent 2 years looking for the right MD who could do prevention and everything else. And no luck. The people just weren't quite at that, what they were looking for. And so they opened it up to PhDs and other MDs. And I was told, you'll never get it. Only MDs are going to really get it, and I got it.
You mentioned you kind of got interested in technology early on, and it seems like a perfect place to become interested in technology and health in that Palo Alto area. But you started doing some really interesting work in citizen science and using citizen science methods. Where did that come from? How did you get interested in citizen science? Because that's not something that came out of psychology right away. It must have come from some talk with others. I don't know. How did you?
Well, I think it came out of psychology in the sense that when you work as a clinical psychologist with people of all walks of life, all backgrounds, you really understand the wisdom of the lived experience, and that no survey that you or I could develop will necessarily capture all of that lived experience. You need to really hear from people. So I think I've always been tuned in to wanting to hear what participants, what patients, what other people in my life think, because you don't really know what it's like to walk in someone else's shoes. Why not have them tell you what it's like and have them decide what's meaningful? So the way it started was back in 2010. I had this incredible group of postdocs working with me, Matt Booman and Sandy Winter and Eric Heckler, all of them luminaries at SBM now. And how wonderful to have them all together. And we got a very small grant from Stanford, tiny little grant, $3,000, I think, to develop an audit tool, a computerized audit tool to capture the environment. And the twist was that I think this is where citizen science in my life was born. Instead of having us decide what the meaningful environmental factors and elements were, which is what all of the audit tools look like, right? The researchers develop them. People walk around and check. Yes, I have trees. I don't have this. Was to allow the residents themselves to decide. Instead of us giving them a checklist, we just had them have a tool that allowed them to photograph and narrate, tell a story about what it was that they thought was important. So to me, that was the pivotal moment where our voice was born, because we found some amazing things that we had never thought of. They were bringing to us, and then we developed it further by not only having them collect the data, but to get together and share their data with each other and to prioritize it into buckets of things that were high priority and potentially feasible to do, not just the high priority stuff that you need lots of money to do, but things that they thought could feasibly be done, and then help them to present that to local decision makers to do some group development of solutions. So that's where it started. And I've now done it. We're now up to over 100 Our Voice projects. We've done it in something like 18 to 20 states in the US, and also a number of countries, 25 plus countries around the world, spanning each continent. And I love this research because you can see the blossoming of empowerment happening, where people who never have had a voice in what their lives are like and what their environments are like, getting that empowerment, feeling that now I have a voice and I can make a difference with other people in my community. And the thing I really get a kick out of is that it empowers the researchers. I can't tell you, Bernard, how many times we have our researchers who are a little skeptical because it's a mixed methods approach. There's a lot of qualitative as well as some quantitative. They're a little worried about the qualitative. Is it rigorous and all of this? But once the researchers get into it, they're empowered too. And we were just talking with one of our research groups the other day, and she used the word magical. And that's not the first time we've heard that word. We've heard it from our Swedish colleagues and others, where they said you give people these tools and then the magic begins. As you watch people who weren't involved, didn't have any voice, now become engaged in this kind of work. It gives me goosebumps talking about it, actually.
No, it's just such a wonderful, innovative method, and I think it highlights so many different things. As you're talking, I was thinking about collective efficacy. In areas where there's so much deprivation, but to be able to put into people's hands the ability to look at assets and also deficits and show that. That's really the power of that, right?
You've nailed it. You nailed it completely. Yeah, so this is my passion. So, I'm watching people around me retire, which is sad. And I feel like I've got a new life now with this endowed professor. So that's the other thing is you never know how things are going to go, how your luck's going to go, but you always want to be prepared to take that opportunity. So our whole team now just has new life, and we're all so excited about this next stage of my lab and our careers.
Yeah, very, very wonderful stuff. And then the ability to do, you said, it may have more qualitative data, but you have big data coming out of it too. And I've seen some of your presentations where you're starting to merge the citizen science story with geospatial data and other data.
Yeah, this whole HAI thing. So the human-centered artificial intelligence, Stanford, as you might imagine, is in it in a very big way. And actually, they have. We just got a grant through our center here, the HAI Center, to add some generative AI components to our voice. And some of that's going to be around having visualizations, bringing them into play. There's some wonderful platforms now that take words, take concepts, and can actually turn them into visuals. And so we're going to be exploring that to see how that helps as people are trying to talk about solutions to help them visualize what something may look like, both among the citizen science residents and researchers, and also the policymakers and the decision makers. And then also with chat GPT kinds of things, making sure, seeing if adding additional voices from the AI world into some of the discussion to see if that actually enriches it or maybe not, to just start to explore how we can take these to the next level.
Some of your work has actually kind of been a prequel to AI, including the citizen science stuff that you're doing now. But using chatbots or automated coaching was some of your early work, showing automated coaching can be somewhat as effective as human interaction. Wonderful work there.
Yeah. So that's another part of me where we study things that we're not good at. So I'm not good at technology, and it's always sort of scared me. So I really am interested in making technologies accessible to everyone, so they're easy to learn and easy to use, and also to see how they can really expand our options and our choices, because we can't always have humans. We don't have necessarily the funds or other things to always have humans. There's not enough human counselors to work with all the people that could benefit from physical activity advice, from smoking cessation advice. So we love to pit the human against the computer. We've done it now in 3 different areas with interactive voice response systems, embodied conversational agents, and texting, just simple texting, automated texting, and interactive texting programs. And in each case, we have found that both of them do very well and work, and that one is not necessarily better than the other in changing physical activity in this case. However, I have to say, for several of our studies, the human touch around well-being and other variables is definitely there. So as good as our embodied agents are, they can't quite bring that magic of the human touch, and the participants feel that. Be that as it may, they're still changing their physical activity. So.
Right. Well, that's interesting. And so we're on this AI sort of revolution now over the next couple of years. And, I was wondering what you thought about this technological revolution and how it's going to impact, our field, and how, it will affect our the work we do in health promotion and prevention. There are some, of course, some scary aspects to it. We hear about that. What are your thoughts on AI
Yeah,
and this
yeah,
new revolution that we're facing?
yeah. One thing that I really appreciate about Stanford is that they very early on have been very keen to understand the ethical considerations of AI and how it needs to be utilized, because we know it can be used for good and we also know it can be used for bad. I mean, that's true of every technology since the wheel, probably, that's happened in humanity. So it becomes very important. And actually, that grant, this intramural grant that we received from the Center on Human-Centered Artificial Intelligence here at Stanford, not only did they put it through a research review, then they put it through a very thorough ethical review. And they have an ethics committee made up of ethicists and people from humanities and from all parts of the university who were very rigorous in wanting to know the specifics of how we were going to make sure that residents weren't harmed in any way or the potential for that, which I really appreciated. And so hopefully, if we're thoughtful about it, hopefully we won't get ourselves in trouble in the ways that sometimes other technologies have happened. So I think we just have to be thoughtful and careful about it.
Right. Yeah, that's a very good point. Don't want to get over our skis on that issue, and but recognizing that it's potentially a powerful tool that will help us um, advance the research, but also advance our ability to connect with our communities in some way, which you're doing with citizen science and applying some of that AI there. That's really interesting. Well, this has been really fascinating discussion, Abby. I'm going to close this out and just ask you to sort of think through a couple of different questions. What are some of the things that you've most enjoyed about your work over your career?
Yeah, I think one of the things that I've really enjoyed is pushing beyond typical boundaries and limits. And that's why I love being at Stanford, because Stanford is all about pioneering, going where no person has gone to. The old Star Trek thing about going where no person has gone before. That's something that really excites me. I've discovered. I never thought I was very creative. Actually, growing up, I always felt like I was terrible at that, and other people were better. I've learned that I can be creative. Bart Taylor had a lot to do with modeling that for me. So I think that's certainly one of the things that I love is being able to be creative and building solutions is something I love. I don't believe there's a problem that we can't find a solution for.
That's wonderful. That does make your work more enjoyable and more gratifying. And in terms of you've had lots of awards and accolades over the years, and I read through your CV and some of your materials, and very many awards. But what are you most proud of in terms of some of your successes?
I think it has to do with the fact that over a decade we've building our voice and finally being successful amidst all the struggles. We had no money for it until recently, all the setbacks for it, being finally able to get this endowed professorship that frees me from a lot of those financial constraints, I think, to really allow us to advance global health equity, which is something that we're very passionate about, and community driven changes that I think we really feel very strongly about.
Yeah, it's really making an impact on community and community partnership and allowing you to advance that in a new method that hasn't really been tested out. And so that's exciting. Um, if you were to encounter the young early stage Dr. King, what advice would you? I know you already shared some lessons, but what key advice would you tell the early stage Dr. King?
Yeah, I think one thing is to stay open for unexpected possibilities. Don't close doors too soon because you never know where something seemingly inconsequential could lead to something big. And that's happened throughout my career. So not narrowing yourself too soon, I would say, in people's research and in their choices more generally. I've noted the persistence thing. I think nothing succeeds like persistence as long as you know when to stop and you know how to bow out gracefully. So, not out, persistence doesn't always lead to success, but it sure can in a lot of instances. I shared the shoulds and musts with you and not listening to other people's shoulds and musts. One thing I found really important is someone who always used to be sort of perfectionistic is when learning when to go for the B in the activities you're doing as opposed to the A's. And I see this in our trainees sometimes, then my mentees, where they treat everything like they have to be perfect at everything. And what you need to do is figure out the priorities of what's really important to get the A on in terms of your work and where the B is just fine. And I think for a lot of perfectionists, that can help. I'd say finding the right mentors is key. Um, uh, Treating others with respect and kindness, these kinds of things. I think it's a small world in our research world, and you really want to treat everybody with respect. And I think one of the great things that I've really enjoyed is just being able to meet and work with all the talented postdocs and junior people and students that I've been working with. That to me, that's my biggest joy these days is being able to lend a helping hand to those behind me who are just amazing. And so I'm very optimistic about SBM and where our field is going because we have incredible young people who are going to really expand our horizons together.
Yes, well, wonderful. Thank you so much for talking with us today. And thank you so much for all you've done for SBM and for leading new areas of science and, generating new knowledge, not only through your work, but also through your trainees and helping them generate new knowledge. So we really appreciate you, Abby, Dr. King. It's been a wonderful conversation.
Thank you so much, Bernard. I've really enjoyed our chat today.
And that brings us to the end of another insightful episode of SBM's Buzz in Behavioral Medicine. Huge thanks to Dr. King for sharing her journey and wisdom with us. Be sure to check out the show notes for links to Dr. King's articles and relevant SBM resources. As we reflect on our conversations and anticipate the future of behavioral medicine, remember, it's our collective drive, passion, and curiosity that will shape the course of the future of behavioral medicine. I'm Dr. Bernard Femler, reminding you that behavioral minds matter. Keep doing the good science you do and the science that does good. Remember to like, follow, subscribe to receive notifications.